Good day. I'm Dr.K Gireesh, physician, neurophysician, and neurosurgeon. This is the RNA series 48. RNA is nothing but random questions in neurology and neurosurgery with answers by Dr. Gireesh. This is in fact to benefit the practitioners of neuroscience and the medical field for a lifelong learning and also for public awareness. The question that I'm addressing in this series or in this session is, what exactly is the glymphatic pathway of the brain and what is its significance? The glymphatic system is a brain-wide waste clearance and fluid exchange pathway that uses perivascular spaces, astrocyte end feet, and aquaporin 4, that is AQP4, water channels, to move the CSF into the brain parenchyma and wash out the metabolic waste via the interstitial fluid. The name combines glial plus lymphatic because it performs the lymphatic-like functions in a tissue that lacks classical lymphatic. As pointed out by D.Litt et al. In 2013, as well as in 2012, the glymphatic pathway is the garbage truck of the brain. It was discovered through 2-photon microscopic examination of the movement of CSF, cerebrospinal fluid, within the live mouse brain in 2012. The brain-wide perivascular network that facilitates the exchange of CSF and interstitial fluid driven by the astrocytic aquaporin 4, AQP4 channels through the perivenous pathways and the meningeal lymphatics play a pivotal role in maintaining the brain in health. So, what is the anatomical and the physiological component of this glymphatic pathway? The CSF enters the periarterial, around the perivascular spaces driven by arterial pulsatility, respiration, and the pressure gradients. CSF crosses into the interstitial through the AQP4 channels densely, which are polarized on the astrocyte end feet surrounding the vessels. And thereafter, the mixed CSF and the interstitial fluid carrying the waste like amyloid beta, tau protein, and the lactate or even alpha synuclein exits along the perivenous spaces. So the periarterial around the CSF goes through the astrocytic end feet, enters the interstitial, and then goes around the perivenous space and out, what you can say, through the dural lymphatics or meningeal lymphatics and into the cervical node and systemic circulation. The efflux ultimately reaches the meningeal lymphatic vessels, then the deep cervical lymph nodes, linking the brain clearance to systemic immunity. What are the driving forces that regulate the flow? That is shown. One is a sleep state. Deep NRM, that is non-rapid eye movement sleep, the slow waves especially, increases the interstitial volume by around 60%, markedly enhancing the clearance. Arterial pulsatility, cardiac and vasomotor waves propel the periarterial flow. Respiration, slow deep breathing augments the CSF movement. Body posture, lateral decubitus, supine, more than supine or more than even prone for the clearance efficiency. AQP4 polarization, loss or mislocalization impairs the glymphatic flux. Why sleep matters? During the slow wave sleep, that is, the NRM has 4 phases, and one phase is the slow wave sleep. It reduces the noradrenergic tone and leads to astrocytic volume changes. expanding the interstitial spaces and accelerating the waste removal. This provides a mechanistic explanation for the long observed link between sleep deprivation and neurodegeneration. Now, what is the clinical significance? It has been pointed out by certain authors. Neurodegenerative disorders like Alzheimer's disease, there is a reduced clearance of amyloid beta and tau protein, as well as with aging, sleep loss, and AQP4 depolarization. The other is Parkinson's disease. It has been studied and found multiple studies using DTI-ALPS. They did show that there is an impaired removal of the waste product alpha-synuclein. Sleep disorders may worsen the progression. Cerebrovascular disease, small vessel disease and hypertension altered the pulsatility. There is a sluggish glymphatic flow, and it contributes to the white matter hyperintensity seen in MRI. Traumatic brain injury, acute suppression of the glymphatic clearance, and leads to accumulation of the tau and the inflammatory mediators, may link to traumatic brain injury to later dementia. Stroke and subarachnoid hemorrhage, blood products obstruct the perivascular pathways. Delayed edema and resolution and secondary injury can occur. Normal pressure hydrocephalus, abnormal CSF dynamics with inefficient glymphatic exchange may explain the gait, cognition, continence triad even beyond the ventriculomegaly. Benign intracranial hypertension, emerging evidence suggests disturbed venous outflow and glymphatic congestion contributing to the symptoms. Now, imaging and research tools are there for this, like the dynamic contrast MRI, the diffusion tensor imaging of perivascular spaces. There is the DTI-ALPS, diffusion tensor imaging along the perivascular spaces. It's again a non-invasive surrogation of the glymphatic function. Now, the in vivo assessment of the glymphatic system in humans presents significant challenges, prompting the development of various imaging techniques to non-invasively probe its function. Several non-invasive MRI techniques have been adapted to serve as proxies of glymphatic activity. These include the phase contrast MRI to measure CSF pulsatility, intravoxel incoherent motion to quantify the microvascular and interstitial fluid movement, and advanced diffusion models to disentangle the free water contributions. These are various authors which have been studied and published. Among these, diffusion tensor imaging along the perivascular space, that is DTI-ALPS, that is the diffusion tensor imaging along the perivascular space index, has recently emerged as a practical and a widely adopted method, as pointed out in his studies by Taoki et al. In 2017 and published in the Japanese Journal of Radiology. The DTI-ALPS index, which quantifies the diffusivity along the deep medullary vein at the level of the lateral ventricle body, enables the in vivo assessment of the perivascular clearance activity and the glymphatic system function in the brain. Research has established that DTI-ALPS index mediates the interaction between the tau v amyloid and 142 ratio and changes in the cognition, and that is closely related to the severity of Parkinson's disease and motor symptoms. Furthermore, lower diffusivity within the perivascular space represented by a decreased ALPS index, and that reflects glymphatic dysfunction within Parkinson's disease. And its relationship with increased plasma nuclear DNA levels suggests an increase in oxidative stress accompanying these microstructural changes, as pointed out by Chen et al. In 2021. Specifically, sleep disturbances, most notably insomnia, obstructive sleep apnea, and rapid eye movement sleep behavior disorder, correlate with decreased glymphatic function in patients with Parkinson's disease, as indicated by the diminished DTI ALPS value. Furthermore, disrupted glymphatic clearance is responsible for the non-motor symptoms such as the mental decline, depression, and anxiety associated with these disorders. Comparable lymphatic deficits have been observed in associated diseases also, like multiple system atrophy, Parkinsonian type of diseases, and corticobasilar degeneration, highlighting the wider application of the ALPS score as a cross-condition imaging agent. Now, in fact, a therapeutic and a preventive approach or implication with all these studies. And it shows that one is the sleep optimization, have an adequate duration of sleep with a circadian alignment is very, very important for the proper glymphatic flow, as well as for removing the waste products from the brain, amyloid B, tau, and others. The vascular health to be maintained, control the blood pressure, and avoid arterial stiffness. Breathing practices, slow, deep respiration can enhance the glymphatic function. Posture during sleep, lateral position may enhance the clearance. And the future targets may be modulating the AQP4 polarization, enhancing the meningeal lymphatic flow and the pulsatility. So there is a one-line takeaway for this particular talk on the significance of the glymphatic system in the brain. The glymphatic system is the brain's night shift sanitation network, powered by sleep, pulsation, and astrocytes, whose failure links sleep loss, vascular disease, and the neurodegeneration. Some of the key scientific references for this particular answer and overview will be on that D.Litt J. et al., published in Science Journal in 2012. A paravascular pathway that facilitates a CSF flow through the brain parenchyma. Z. L. et al., Sleep drives metabolites clearance from the adult brain, published in Science 2013. Rasmussen, M.K. et al., published in 2018 in Lancet Neurology, The Glymphatic Pathway in Neurological Disorders, an article worth reading. Then Nedergaard and Goldman, also published in 2016. De Mosquito et al., The Functional Aspects of the Meningeal Lymphatics in Aging and Alzheimer's Disease, published in Nature in 2018. And Thrain et al., The Critical Role of Aquaporin 4 in Glymphatic Clearance in the Journal of Neuroscience 2014. And also Benvizet et al., The Glymphatic System and the Waste Clearance with Brain Aging in Gerontology in 2019. These are some of the publications, but there are very many works that are being done, and that is for an update for everyone to read. Well, that is in brief on the significance of the glymphatic flow or the glymphatic system of the brain. Thank you very much.